Hello. My name is Jones, and today we are going to look at rheumatic fever. Rheumatic fever is a poorly understood inflammatory disease that occurs after pharyngitis. It is a self-limited illness that involves the joint, skin, brain, serous surfaces, and the heart. Definition. Rheumatic fever is a systematic inflammatory condition of the connective tissue in the body following infection of the upper respiratory tract by group A beta hemolytic streptococci, and it involves the joint, skin, brain, serous surfaces, and the heart. Cause: group A beta hemolytic streptococci. Incidence: rheumatic fever is common in children between 5 to 15 years. Pathophysiology: rheumatic fever follows an infection of the upper respiratory tract by group A beta hemolytic streptococci, such as pharyngitis, which causes immunological reaction in the body. The principal manifestation of rheumatic fever are observed in the heart, joint, skin, and the central nervous system, particularly the brain. The inflammatory hemolytic borus region, called Ashkoff bodies, are formed, which cause swelling, fragmentation, and alteration in the connective tissue. These bodies are virtually found in all patients with rheumatic activity. The regions are found in the heart, blood vessels, brain, and serous surfaces of the joints and pleura. The major cardiac manifestation of rheumatic fever is carditis, which involves the endocardium and pericardium and the myocardium. Carditis is mostly associated with the mitral valve, and it causes mitral incompetence or stenosis. This will be characterized by an apical systolic murmur which reflects a mitral regurgitation. The murmur is long and high-pitched. Other murmurs may be present which may reflect aortic regurgitation. If the skin is affected, it causes erythema magnatum. Erythema magnatum is a wavy, thin red line skin rash on the trunk and extremities. In the joint, it causes inflammation or polyarthritis. Many joints are affected at the same time. That is what we mean when we say polyarthritis. In the brain, it causes rheumatic chorea, which is characterized by irregular, jerky, involuntary, unpredictable muscular movement due to muscle spasm of the face, shoulders, and hips. And then you talk of St. Vincent's dance because of this chorea. Signs and symptoms. Rheumatic fever has 5 major manifestations, and these are carditis, polyarthritis, erythema magnatum, subcutaneous nodules, and then we have chorea, which I said St. Vitus's dance or Sedanum chorea. So now, what do we mean when we say carditis? This is inflammation of the endocardium, pericardium, and the myocardium that may be due to invasion of the heart by the streptococci, and the patient will present with breathlessness or edema. Carditis is most commonly associated with the mitral valve, in which there is a presence of an apical systolic murmur reflecting mitral regurgitation. Polyarthritis. This may be due to invasion of the joint by the group of beta hemolytic streptococci, which causes inflammation and fusion in the joint tissue. So it will cause a fusion in the joint tissue. The infection favors large joints such as the knees, elbows, hips, shoulders, and wrist. Joint manifestation is usually accompanied by an acute febrile period for 1 to 2 weeks, and if left untreated, it can persist for 4 weeks. Erythema magnatum. There is a wavy, thin, red line, non-pyrolytic skin rash on the trunk and proximal extremity, which can disappear within a few hours. This is due to antigen-antibody reaction. Then we also have subcutaneous nodules. These are small, non-tender swelling that form over bony prominences of the body, such as feet, hands, elbows, scalp, and the vertebrae, because of the presence of infection in the skin. Then chorea or symphysis dance or sedentary chorea. It is due to the effect of group A beta hemolytic streptococci on the central nervous system. Chorea is characterized by sudden, aimless, irregular movements of the extremities. There can be involuntary facial grimace, speech disturbances, emotional liability, and muscle weakness. It is usually exaggerated by anxiety and attempts at motor activities, also relieved by rest, especially sleep. What are some of the minor manifestations? Fever is one of those minor manifestations because of the presence of infection, which results in antigen-antibody reaction. Then the patient may also have a painful joint, which we call arthralgia. So that is it. Today we have been looking at rheumatic fever. We have defined it as a systematic inflammatory condition of connective tissue in the body following an infection with an upper respiratory tract group A beta hemolytic streptococci. And it involves the joint, skin, brain, cellular surfaces, and the heart. We have discussed talking about the causative, we have discussed talking about the incidence, we have also discussed the pathophysiology, and lastly, we looked at the signs and symptoms of rheumatic fever. So thank you very much, and keep studying.